Alright guys, welcome back. Today it is story time on the Mad Medic Learning Network. And the reason that I say it's learning time is because I'm going to talk about a very specific drug that we used to use for your SVTs, which was Verapamil, or as we like to call it, Verapamil. And there's a reason we call it that. And let me explain what this funny story is. Funny story is I'm in the Salt Springs grocery store parking lot. And we got a patient, SVT, about 220, 230, stable, but, he's feeling a little bit. And so I go to give the drug, and my partner is taking the Life Pack 5, and he pulls the paddles out, and he starts to gel them. And I'm going, what in the world is he doing? And he's like, trust me. And again, he was an old salty guy. And so sure enough, I start giving the Verapamil. It's 5 milligrams of Verapamil. And I start giving it, and all of a sudden the guy goes into VFib. And he's like, he throws the box of calcium chloride at me, and he says, push this. And he reaches over and grabs the paddles and wham, nails the guy. And so all of a sudden I push the drug, I flush it, and all of a sudden, boom, he's back to life. And I was like, what the heck? He goes, yep, you gave it too fast. He says, and that's why, he says, one of the biggest things with that drug is they go into VFib. Now, meanwhile, remember, I'm all of literally, this was like my third shift on the ambulance as a paramedic. So I'm absolutely 1,000% freaking out going, what the, So at this point, again, I learned a very valuable lesson about Verapamil. Now, did I remember this? Yeah, I thought I was giving it slow. Well, no, I wasn't even close. So, again, narrow complex, I pushed it, and guess what? He's just let me have it, right? So there's the story in a nutshell. We get the patient back into normal sinus rhythm. So that's why we call it Verapamil. The other drugs, though, that it's actually known as is isopten or Kalen. Kalen's probably the big one you're going to hear. And they do use it for blood pressure problems. So you're going to see it in the pill form, okay? That is the normally how they take it. And it's, again, used to help control blood pressure. It's a calcium channel blocker is what it is. It's an antiarrhythmic, it's an anti-anginal, and antihypertensive drug. So it's got some wonderful effects, but if you give it IV, got some things that can happen, okay? Now, the good news is that's why we use diltiazem, guys. Diltiazem is a lot safer than your Verapamil is, okay? Again, it's still got a few unforgiving side effects, but not near as bad a side effects as Verapamil does, okay? So again, it can cause coronary and peripheral vasodilation, and therefore it decreases the myocardial oxygen demand, which is another reason we kind of like it. Here's the problem, is it can cause a slower atrial and ventricular response and actually send them into VFib, okay? So when we do give it, it's usually about 2 to 15 minutes, and then the duration is usually around 30 to 60 minutes. Which is the other thing is that kind of like why they like diltiazem, because it lasts a little bit longer as far as we usually run it in as a slow drip after that. Where with the Verapamil, they're kind of about giving it a drip form. So again, SVT, PSVT, if they got premature atrial tachycardia, A-flutter, AFib, remember, it's slowing conduction through the AV junction. That's exactly what it's supposed to do. And your vagal maneuvers didn't work, okay? Non-EMS uses, again, they use it to control blood pressure, which is why you're going to see this as a daily med sometimes with your patient. Again, blows out blood pressure. If you give it too much, they're going to be asystole. Remember, these guys are stopping the new kids from opening the door for potassium and sodium, okay? That's what it does. It's the bully, okay? It doesn't let them open the door so the cool kids can come in and the nerds can go out, okay? So, again, that's what calcium does for our cell. So, it can cause congestive heart failure. It can cause an AV block to happen. They can go into sinus arrest, and here's the big one. That's right there, VFib. Not that I'm nervous about giving that or something. But, yeah, it only takes one time for you to figure that out. Again, it can also cause peripheral edema. So, if you're reading these side effects, hopefully you're saying at this point, I probably shouldn't give it to somebody who's got severe CHF. You're absolutely right. Also, if they got Wolff Parkinson White with AFib or A-flutter, do not give this drug. No calcium channel blockers, okay? If they've taken IV beta blockers, again, if they're in cardiogenic shock, if they're having an MI, stay away from this drug, okay? It's for electrical issues, all right? And then why complex tachycardia is, it's not given, okay? So again, it's going to slow conduction to the AV junction. Well, if it's coming from the ventricles, newsflash, that's not going to fix your problem. So again, it can cause pulmonary edema, peripheral edema. It can cause actually sick sinus syndrome. Basically, when the sinus node goes nuts, okay? 180 1 minute, 40 the next, 110 in cardiogenic shock, back to 40, back up to 160. Yeah, it's a really fun time. When I say fun time, I mean it's not fun for anybody. Now, interactions, again, digitalis. It doesn't like dig too much, okay? It increases digitalis effects. So if you give this and then all of a sudden they go, I see lights around the eyes, guess what? Calcium chloride is your reversal agent. Calcium gluconate can do it too. So again, it's additive. You can have hypotension when you're on other types of hypertensions. If you've given them nitro, gang, it can potentiate those effects. All right, so ease up on, again, keep that in mind before you go spraying them with nitro too much, all right? It can definitely make congestive heart failure worse, so if they got any signs or history of it, you probably need to stay away from it. And then using caution with any type of cardiovascular, liver, or renal insufficiency, because remember, it's going to exacerbate those problems. That's a big word for the day, exacerbate. Again, smaller amounts over a long period of time is how we treat blood pressure with these, usually a PO type medicine. So again, it's by mouth. That's how they usually use it. It's usually very small. 2 milligrams is the ones you usually see out there in the field. If they've got any type of AV block or slowed AV conduction, I would probably kind of shy away from left and right bundle branches as well. Any type of heart block, you really don't want to give this drug. And again, many physicians actually give 500 of calcium chloride or the equivalent of calcium gluconate before they give the Verapamil, so that you don't get the unwanted effects. And the biggest, I think we used to carry it in the 5s. I don't worry about the dosing too much, but it's usually 2.5 to 5 was the dose I remember. But again, you can repeat it one time. Usually if you repeat it, you double the dose. Okay? But again, be careful. Your max dose is going to be 30 milligrams. Okay? Pediatrics, yeah, call a friend. We probably don't want to give it to pediatrics, even though this is what the dosing says. Again, we usually don't give it in the pre-hospital setting. And then we can give it IV or IO. Do not give it any other way. Pregnancy, it's actually a pretty safe drug for these guys as well. All right, so that's it about Verapamil. So again, guys, slow. Anytime you're given any calcium channel blocker, slow. Okay, give it slow. All right, that's it for today, and I'll see you guys on the next one.